ลำดับต่อไปนะคะจะขอนำท่านเข้าสู่การบรรยายโดยวิทยากรหลัก2ท่านนะคะโดยจะเริ่มจากดร. Roumpakis แต่เนื่องจากความแตกต่างด้านเวลาทำให้ท่านไม่สามารถบรรยายสดได้ท่านจึงได้มอบวิดีทัศน์การบรรยายของท่านให้กับทีมงานไว้นะคะก่อนที่จะรับชมการบรรยายจากวิทยากรท่านแรกดิฉันขอแนะนำประวัติของท่านโดยสังเขปดังนี้ดร. Antonios Roumpakis ตำแหน่งของท่านคือ Chair of the Board of Studies, Department of Social Policy and Social Work, University of York, United Kingdom ท่านเป็นรองศาสตราจารย์นะคะด้านนโยบายสังคมเปรียบเทียบภาควิชานโยบายสังคมและสังคมสงเคราะห์มหาวิทยาลัยยอร์กแห่งสหราชอาณาจักรนอกจากนี้ท่านยังเป็นคณะกรรมการบริหารสมาคมนโยบายสังคมแห่งสหราชอาณาจักรเป็นผู้อำนวยการหลักสูตรปริญญาโทด้านนโยบายสังคมและคณะบรรณาธิการของ Social Policy and Society นะคะสำหรับท่านที่มีคำถามหรือความคิดเห็นที่ต้องการจะแลกเปลี่ยนกับดร. Roumpakis นะคะให้เขียนไว้ในแชทบ็อกซ์ได้นะคะทางทีมงานจะรวบรวมนำส่งท่านต่อไปค่ะจะขอเชิญทุกท่านรับชมการบรรยายพร้อมกันหลังจากที่อาจารย์เพรสได้แนะนำประวัติของวิทยากรเป็นภาษาอังกฤษนะคะเรียนเชิญอาจารย์เพรสค่ะ
So to begin our first session, I'd like to warmly welcome our distinguished keynote speakers who are social work and social policy experts from the UK and Taiwan. Both our keynote speakers will give a 25 to 30-minute presentation. Given the time difference with the UK, Dr. Roumpakis has kindly provided a recorded version of his presentation. So please do use the message function on the screen to send us any questions you may have for Dr. Antonios. And we will then follow up with him after the seminar and provide his feedback to participants later. Professor Pei Shan Yang will then join us live from Taiwan and take any questions from you directly after her presentation. So let us begin with Dr. Antonios Roumpakis. Dr. Roumpakis is an associate professor in the comparative social policy at the Department of Social Policy and Social Work, University of York in the UK. He's a member of the UK Social Policy Association Executive Committee and an editorial board member of Social Policy and Society. He was the director of Social Policy Master School and now serves as chair of Board of Studies. Let's start the recording. Thank you.
Hello, everyone. My name is Dr. Antonios Roumpakis. I'm a senior lecturer in comparative social policy at the Department of Social Policy and Social Work at the University of York. I'm very happy to be able to participate, even if it is via a recorded presentation at the 67th anniversary of the Faculty of Public Administration at Thammasat University. I was very happy to receive the invitation by Professor Dean Rapipan Kumhom. I hope I'm pronouncing this correctly. And of course, Professor Pushong Sananuch and Mr. Brett Evans. So I've been invited to talk about social welfare responses and challenges to the COVID-19 pandemic and offer reflections from the UK. Before I begin my presentation, I would like to say that the presentation draws evidence and policy updates from a very recent policy report that was put together by two of our own postgraduate students, Shoshdil Gil Camacho and Eriko Aono, as well as Professor John Hudson and Professor Neil Lunt. I would like to begin with the state of social welfare before the pandemic. And I will quickly say that in the 10 years before the pandemic, the UK had voted in a conservative-led coalition government which was elected in power and introduced substantial cuts to social security, whether this was applied by changes to indexation rules, freezing working age payments, or reduced levels of generosity in payments for families. One of the flagship programs of the UK and sort of the coalition, if you want, government at the time was the launch of Universal Credit, which merged 6 previous separate means-tested programs tailored and targeted to unemployed, disabled people, lone parents very often, as well as people who are seeking jobs and the unemployed. One of the distinctive features of the universal credit was not only trying to put all the social security benefits together, but also introduced very strong and clear incentives in pushing people back to work and increase their hours of paid employment. That meant very often that people had to basically make sure they do follow all the necessary rules and guidance of the universal credit, meaning that they apply for jobs or that they receive in-person training. Failure to do some of those things meant actually that they will not be receiving anymore that benefit support. So the idea of welfare conditionalities, which is a main and one of the key actually research projects that is actually also taking place at the University of York in the Department of Social Policy and Social Work, is reviewing how effective and successful universal credit has been. And just to say that it has been, and it has attracted a lot of debate and questions whether this is even ethically the right approach. It is important, however, to say that the state of the National Health Service, the NHS, which is universal, is accessible to all citizens and residents actually in the UK, was already under severe pressure with many trusts and hospitals in serious debt. And this was already before the pandemic. Additionally, there has been a lot of marketization in terms of social care with significant regional and local variations in terms of costs. So the marketization effectively involved shifting the responsibility and costs of providing social care to the service user. The handling of the pandemic and the initial response, again, did attract a lot of questions whether it was the appropriate one at the time. I won't go into too much detail about this, just to say that the first case of COVID took place on the 31st of January in 2020, but the full lockdown was only announced about 50 or 55 days later. The government that was elected very recently in 2020, December 2020, was already aware that it has been and was reported by an official exercise, if you want, that the UK was not adequately prepared to respond to a possible pandemic. And this was due to the insufficient number of intensive care units and low number of hospital as well as doctors recruited by NHS. Therefore, it was suggested already back in 2016 that the UK would not be able to cope with a severe pandemic, a warning that was not considered as something that would actually materialize as a concern. So it wasn't properly, or perhaps it was not set very high on the agenda of a government that was always very keen. The last 10 years we have a conservative government in the UK, very keen on austerity. One of the other important aspects when it comes to the UK is that the UK has devolved authority of health policy to 4 nations. So England, Scotland, Wales and Northern Ireland have the ability to basically introduce their own policies and be more attentive to their own conditions and needs. But at the same time, this meant that it would be a coordination challenge, as it was very hard to deliver both consistent messages and actions. The spread of the pandemic, you can see the number of cases, and what I have here is the total cumulative number of cases in the green, admissions in the sort of more pink, and deaths in a sense in the sort of purple color. And you can see that the number of cases has increased substantially over the last couple of months. The number of admissions has also increased, but definitely not as high, and the number of deaths has increased, but again not at the same pace by any means as the number of cases. Still, however, it means that the handling of the pandemic continues to be an issue, given that the last date included in this graph is the 15th of January 2021. What I have also included is the cumulative total cases per million. And again, here's how the UK compares with other selected OECD member states. And you can see that it's doing better than others, but also worse than some countries such as, for example, Germany, Canada, Denmark, Italy, etc., etc. The only countries that are doing worse in terms of the number of total cases per million of people living in the country are Portugal, Sweden, Netherlands, Belgium, and United States is leading the table here. When it comes to the cumulative total deaths per million people, you'll see that the UK actually overtakes United States, although Italy and particularly Belgium have such a high stark number of deaths overall. So the UK has been affected in terms of the pandemic, both in terms of the cumulative cases and number of total deaths as a percentage, if you want, counted as per million of citizens and people. The UK experienced a dramatic drop of GDP in the second and third quarter of 2020. The GDP continues to decline, but with a lower pace for the fourth quarter of 2020. Economic recovery remains slow, sluggish, with some sectors struggling to survive, especially retail and hospitality. Government support measures prevented the drop of average household income, but inequalities remain, and so does actually household debt. If you see in some cases like Canada or the United States, the real household income has actually experienced an increase rather than a decline. United Kingdom, France, Germany, and more perhaps drastically Italy are facing a few more difficulties in maintaining fully that level of income. Still, the UK is doing comparatively well when it comes to the average real household income. Inequalities, however, remain. As we said, there was a Public Health England report on Black, Asian, minority ethnic groups that did identify that individuals from the BMA groups are more likely to work in occupations with a higher risk of COVID-19 exposure. They're more likely to use public transportation. And at the same time, research has identified that both ethnicity and income inequality are independently associated with COVID-19 mortality. The emerging evidence have suggested that excess mortality due to COVID-19 is higher in BME populations, and in particular Black African or Black Caribbean men. The risk associated with COVID-19, transition, morbidity, and mortality are also exacerbated by household and housing challenges, as many members of BME groups are living in housing conditions where there are more members in the household living together, and therefore they do not have adequate space, let's say, to work from home, for example. Historically, there has been negative experience of healthcare or at work, which often mean that individuals from those groups are less likely to seek care when needed. So what we definitely know is that there has been a racial, perhaps, sort of angle approach, and we need to be focusing in the UK, and it's very clear that Black, Asian, minority ethnic groups are far more likely to face higher risk during the pandemic. And this is based on all of these structural inequalities that are actually pre-existed the pandemic. There is more income inequality and relation in terms of, deaths in particular. And one of the things that we know is that the coronavirus has had a proportionately higher impact on the most deprived areas. So here, a study from the Office of National Statistics on deaths involving COVID-19, you will see that the most deprived areas are indicated by number 1, the least deprived areas indicated by number 10. You will see that the number of COVID-related deaths is very high, and it does overtake the number of all deaths. And as you will see, the same will apply for group 1, 2, and 3. So basically think about it more as an income, if you want, group, the 10 lowest percentage of income, but also by deprivation. Here we're talking about access to green, access to open space, access to sort of good housing, etc., etc. So it's a deprivation index, really. But I think even thinking about it in terms of income makes a lot of sense, to see that people who are more likely to be at risk of poverty or facing not the best possible living conditions are experiencing a far higher risk when it comes to COVID-19. And you will see that on the least deprived, the most rich and sort of percentage of the population, very little evidence that there has been an impact in terms of deaths. So the pandemic has exacerbated perhaps existing class divisions, but at the same time, it has identified occupational divisions as well. So while the pandemic does not discriminate, labor market conditions and income replacement measures do. And that is something actually the Trade Union Congress suggested, and I think their report actually is really interesting because it does identify which occupations are more likely to be able to work from home and which occupations have to be out of home, getting more likely to be in touch with people and therefore more at risk of COVID-19 infection. So a lot of the key workers, nurses, drivers, educators, for example, especially in nurseries or carers, are very likely and face an increased risk in terms of catching the virus. And at the same time, however, although they're necessary for the economy to work, at the same time, they are not the best paid. They're not the best, they're not earning a lot of money. And some of them actually are earning less than £10 per hour. We also know that the proportion, the split between men and women actually favors men, and women actually, 2/3 of women are earning less than £10 an hour in those particular key working, if you want, groups. So the table here demonstrates that professionals, managers, directors, professionals or administrative staff can work from home, and they have been doing that. So if you see all persons is pretty much the average, you can see that from 1 to 4, they are much higher in terms of their ability to work from home, whereas manual workers, sales and customer service occupations such as supermarkets, as well as leisure and service occupations that remain open, as well as skilled trades occupations, are more likely to be exposed in terms of contracting COVID-19, simply because they are out and about. The challenges and responses to social welfare. I would begin with some of the most important responses when it comes to social security, and say that there has been a temporary increase in the payment of universal credit and working tax credits by £20 a week, although now this is being discussed as sort of being removed actually, but it has been there since March, April, until basically January. And there has been also a temporary suspension of work search and similar requirements for universal credits. So the sanctions, the threat of removing income support has been withdrawn or suspended, at least for for a few months. And also the same applies, there's been a temporary suspension of the minimum income floor for self-employed workers in universal credit as well. At the same time, the government has provided an increase in the local housing allowance and has offered supermarket vouchers to families whose children normally receive benefit-related free school meals. As schools are closing, they are able at least to receive some form of supermarket vouchers to sort of compensate for the lack of access to nutrition for their children. The number of people claiming unemployment benefits reached 2.7 million in August in 2020, and although it represents an increase of 120.8%, it's remarkably lower than the government originally anticipated. And the reason for this was the job retention scheme. Basically, the UK here followed a similar pattern as other EU countries in offering a job retention scheme, which is basically taking the idea from the German Kurzarbeit program, which aims to prevent unemployment and instead offer support to those already in employment as well as employers to keep jobs. So instead of having somebody being unemployed, the idea would be to provide support both to employers and their employees to keep their jobs. The coronavirus job retention scheme is paid by the government to furloughed workers who have agreed with their employer to have a temporary leave due to reduced business activity resulting from COVID-19 restrictions. The coronavirus job retention scheme offers 80% of employees' wage, and there is a cap, however, a maximum of income that they can be receiving, and that cap is £2,500. Employers may choose to add the remaining 20%, but they are not obliged. And ever since September 2020, there have been fluctuating levels of generosity and amount of, both in terms of the percentage and the amount of money that can be paid, the cap. It has been going down, but it has been picking up again because we entered another lockdown. Overall, the job retention scheme has been successful in preventing huge unemployment increases, but at the same time, what we are witnessing is that 1 million people are becoming economically inactive. They no longer seek work or any kind of income replacement support. And the estimated cost by the end of the job retention scheme, which is scheduled for March 2021, the estimated overall cost is £52 billion. Here is a graph just to show you the popularity of the measure, and the line here that kind of goes up over time is the total value of claims made, and sort of adding up to the amount of money. At the time, here is 18th of October, and it was 41.4 billion. As I said, it is estimated by March 2021, it would reach around 52 billion. A similar support scheme was introduced for the self-employed. The only difference here was that the calculation depended very much on how much money the self-employed made in the previous 3 years. They were given, again, the government paid 80% of the average monthly trading profits in those 3 previous tax years. But again, for those 3 months, there was a maximum of payment of £7,500, very much equivalent to the furlough scheme. So 80% the government will cover up to £2,500 per month. Again, the levels of generosity fluctuated, very similar to the job retention scheme. And just to say that there has been, a substantial debate whether, if somebody hasn't, for example, been self-employed for more than a year, will not have access to the support scheme. So whether that's fair or not, but it is one of the conditions, it is one of the parameters of the program. Also, people who are earning or did earn more than £50,000 in the year before are not entitled any support. In terms of housing, there have been a few interesting developments that I think do reflect what is happening, but at the same time, I think they are basically trying to work together with private as well as public landlords and also banks. So first thing is notice periods for evictions as well as housing repossessions have been suspended. The local housing allowance has increased to cover up to 30% of market rents, with additional support offered to low-income households living in private rented housing. Banks and housing associations were instructed to offer 3 to 6 months payment holidays of mortgages and housing loans to households who experienced income losses due to the pandemic. Additionally, the government has provided some support to the homeless and rough sleepers, and also some minuscule, I will say, very light support and very subject to very strict low income criteria for those who are able to work from home, and sort of reflecting the fact that given that the winters in the UK are pretty cold, you will need to warm fuel, sort of buy fuel for your house. The last aspect is the health and social care, and I have identified here some key measures, and I've tried to put them in dates just to sort of see the development of the social care in particular strategy. And the initial response was to pour more money into the response of NHS, about 5 billion in March 2020. And in April 2020, there was a plan for adult social care. So originally the focus was health, then it became social care. And of course, at that moment, there was the realization that there are not enough adult social care workers to support those in need. So there was a campaign and an incentivization to get 20,000 people into social care very quickly. Additionally, there were 600 million pounds as part of a care home support package to local authorities. And in July 2020, there was a new social care testing strategy with care home staff given COVID-19 tests on a weekly basis, with residents of those care homes doing basically given monthly tests to reduce the transmission. In August 2020, about 600 million pounds were offered to cover the cost of post-discharge recovery and support services until a person's care needs are assessed, or for up to 6 weeks following discharge. And in November 2020, the registered carers looking after people in their own homes were also able to have access to COVID-19 tests. Couple of reflections. The responses to the crisis, if anything, have actually put, social welfare definitely at the epicenter of the response. The response to the pandemic did aim to prevent huge increases in unemployment through massive job retention schemes. It did try to support the self-employed. It weakened and suspended basically the sanction and the sort of punitive, if you want, elements for providing welfare support. And there has been small increases in terms of the generosity. Local governments have been receiving additional funding support to provide and organize care homes in their localities. And in a sense, the Conservative government in place has extended the welfare state budget beyond, and sort of increased public debt, which is almost like an anathema for Conservative politicians in the UK, but has been able to claim political credit for these interventions. So it's really interesting simply because we are witnessing at the moment a response that is very different to the traditional, if you want, approach that Conservative governments have or had in the last 10 years before the pandemic in the UK, and the current Conservative government has expanded the welfare state. But does this mean that this is here to stay? I agree, and following actually from the work of John Hudson, Neil Lunt and Ruth Patrick, that they suggest that we should be cautious in assuming the pandemic will be a new beverage moment for the UK, a moment where the welfare state once more is expanding, signaling sort of key responsibilities of the state in several sort of policy areas. Simply, we don't know if there is a sort of enough political support for this. We are still in the process of dealing with the pandemic. So the emergency nature of these interventions might not be politically viable. The challenges ahead, I think the current response has demonstrated that there are important governance and political divisions emerging. In particular, there have been important differences and divisions when it comes to the attempt to devolve governments. So basically Scottish, Welsh, or even the Northern Ireland governments into the response to the pandemic. But there has been also more tension with local or city governments, Manchester Mayor or London Mayor, for example, disagreeing very often with Westminster and the current British government over the handling of the pandemic and the unequal financial support provided. That applies not only between the different nation states in the UK, but also between the different cities and regions. At the same time, I'll say that the British government has not been very consistent in its message, and this is something that definitely should have been avoided, as it have had a detrimental effect on public trust. Of course, the other big question is public finance. Who will foot the bill? And there is a questions here whether narratives or debates about deserving and the undeserving will emerge, and also whether the Conservative government will increase corporation tax or top income tax to fund the public deficit, the public budget deficits. If anything, in my opinion, the Conservative government is probably best placed to do that, given the extraordinary sort of politics and of the pandemic involved in the UK, in the sense they have been expanding the welfare state because of the emergency, and perhaps they might introduce an emergency, if you want, but temporary increase in corporate tax or even top income tax. Finally, I would just like to draw your attention to something I feel is very important in terms of dealing with the pandemic and going ahead, and that is the area of social reproduction. In particular here, what I have in mind is that the response to the pandemic has, if you want, demonstrated the centrality of caring, of child schooling, of all those activities that sometimes very many people take for granted, such as nurseries, primary or secondary schools, or even more importantly, care. And this is a time where all of those responsibilities are within the family and within the household. And the ability of many people to balance, let alone, if you want, manage to work and also offer caring or child schooling for children who are staying at home is increasing the levels of stress to households. I think this is going to be an emergency. This is going to be very soon if we do not overcome very quickly the pandemic. It has the potential of becoming a very serious issue in the UK going forward, but I would say probably it's not the UK alone that is facing this pressure in terms of increased levels of anxiety and stress among the households. Additionally, what has been highlighted is that education and educational institutions and organizations, including nurseries, and essentially all aspects of care, how essential they are for allowing and transitioning people back to work. I think this is a lesson, and this is something I hope we learn in terms of respecting and recognizing the importance of care and education, partly and in sort of recognition even in terms of the hours spent predominantly by women, predominantly unpaid work as well. And finally, I think the crucial point, as with any crisis, is public trust. And this is something where the UK government could have done a bit better, and I think they will be making a lot of efforts to recoup, if you want, some of those levels of approval and trust in the handling of the pandemic. And finally, the final point to me is morale, is the collective as well as the individual morale, if you want to. And I think the societies, especially that have been in 1, 2, or 3 lockdowns, as we have in the UK, are desperately looking for some positive news. And I will conclude on this final slide that the vaccinations have started. The UK actually has completed, at the point of recording this lecture, about 3 to 4 million vaccinations, but we still have a long way to go. I hope this has been helpful. Thank you very much for your attention, and I'll be very happy to receive any questions you have. All the best to your proceedings. Stay safe. Take care.